Hello, greetings. Okay, so let us go through sickle cell anemia in pediatrics with Miss Andes Ngam. Okay, so the stem of the question reads, Michael Chibale, a 13-year-old boy from a well-known sickle cell parent, has been brought to your ward in a sickle cell crisis. Question A, explain 4 types of sickle cell crisis, 20%. Question B, state 5 signs and symptoms that Michael will present with on admission, 15%. Question C, identify 5 problems that Michael will present with and use the nursing care plan to nurse him, 50%. Then the last question was saying state 5 complications that Michael is likely to develop from this condition. Marks allocated, 15%. Okay, so the first question is asking us on the types of what? Sickle cell crisis. Okay, so there are basically 4 types. We have hemolytic crisis, we have thromboembolic crisis, we have spleen sequestration crisis, and we also have aplastic crisis. Okay, so the first one, like I mentioned, is what? Hemolytic crisis. So in hemolytic crisis, here there is massive destruction of red blood cells, because in sickle cell disease, the red blood cells, they tend to be what? They tend to be fragile. Because of that, they easily get hemolyzed. Remember, in sickle cell anemia, the lifespan of red blood cells is reduced from 120 to 30 days. Yes, so because of that, because of severe hemolysis, this will eventually lead to what? Low oxygen carrying capacity. A person will complain of what? Of difficulties in breathing and other signs of what? Anemia. Yes. The second type of sickle cell crisis is thromboembolic crisis. So thromboembolic crisis is sometimes referred to as what? Vaso-occlusive crisis. Okay, so in vaso-occlusive crisis, here there is what? There is obstruction of the blood vessels due to what? Due to thrombosis. Yes, the red blood cells, they occlude the what? The blood vessels. Because of that, they will lead to what? Obstruction of blood flow to certain what? Organs such as the kidneys. Yes, so that obstruction leads to what? Low oxygen tension in the area distal to the what? To the point of occlusion. Yes. In thromboembolic crisis, some complications such as stroke may eventually what? Develop. Complications such as ulcer formation may also develop in what? In thromboembolic crisis. The third type of crisis is spleen sequestration crisis. Okay, so in spleen sequestration crisis, here you find that a large amount of blood gets trapped in the what? In the spleen. Because of that large amount of blood that has been trapped in the spleen, there will be what? Circulatory collapse in general what? Circulation, and that will eventually lead to low oxygen what? Levels. Yes, so this will lead to a crisis. The last type of crisis is aplastic crisis. Okay, so in aplastic crisis, here the bone marrow gets what? Suppressed, right? The bone marrow will be unable to produce enough what? Red blood cells, and that inability of the bone marrow to produce red blood cells will result in what? Reduced oxygen carrying capacity. Yes, because of what? Reduction in red blood cells. Remember, the red blood cells are the ones that carries what? Oxygen to all body tissues. Okay, then the second question was asking us to state 5 signs and symptoms that Michael will present with on admission. Yes, it was asking us on the clinical features. Okay, so what are the signs and symptoms? The first one is what? Jaundice. Of course, jaundice, it comes in due to increased levels of what? Bilirubin as a result of increased hemolysis. The second one is fever. So fever, this one comes in due to what? Due to the inflammatory reactions that has been caused by what? Tissue infection. The third feature, bone pain. So bone pain, this one comes in due to what? Due to ischemia. Yes. Abdominal pain. Abdominal pain, it also comes in as a result of what? Tissue ischemia. Difficulties in breathing. Difficulties in breathing, this one comes in due to reduced oxygen carrying capacity. Cyanosis. Cyanosis, this will come in due to what? Due to tissue hypoxia. Yes. This child may also present with what? Painful erection. Yes, the child will also present with painful erection on what? On admission. Okay, so those are some of the clinical features, signs and symptoms that Michael present with on admission. Then question C. Question C was asking us to identify 5 problems that Michael will present with and use the nursing care plan to nurse him. Okay, so what are those problems? Okay, so the first problem is what? Difficulties in breathing. Yes, difficulties in breathing. So difficulties in breathing, it comes in due to reduced oxygen carrying capacity. And the evidence is what? The evidence is cyanosis or increased what? Respiratory rate. Okay. The other problem that this child is likely to present with is what? Acute pain. So acute pain, this one is related to what? Vaso-occlusion. Yes, manifested by restlessness and also verbalization. Yes. The third problem that I can mention is what? Knowledge deficit. Yes. So knowledge deficit, this one is related to what? Related to misinterpretation of information. Yes, the evidence is the child asking too many questions. Yes. The other problem that I can also mention is what? Anxiety. So anxiety, this one is related to what? Is related to little knowledge about what? The prognosis of the condition. Yes. So the manifestations or the evidence is restlessness and also lack of what? Sleep. Okay. The other problem that I can also mention is risk of what? Risk of fluid volume deficit. Yes, risk for fluid volume deficit. So this one is related to what? Renal parenchyma damage. Yes, this one is related to renal parenchyma damage. The other problem that I can mention is what? Risk of secondary infections or risk of nosocomial infections. So risk of nosocomial infections, this one could be related to what? Reduced what? Immunity. Yes. So those are some of the problems that we can mention in what? Sickle cell disease. The last question was saying stage 5 complications that Michael is likely to develop from this condition. Okay, so what are some of the complications that this child is likely to develop from this condition? Of course, we have renal failure. Yes, that's the first one. This one comes in due to what? Vaso-occlusion. We also have cardiomyopathy. It also comes in due to what? Vaso-occlusion. We can also talk about retinopathy. Retinopathy, it also comes in due to vaso-occlusion. We can talk about growth retardation. This one comes in due to increased attacks of what? Crisis. Yes, we can talk about Splenomegaly. So splenomegaly, this one comes in because of increased what? Blood that has been trapped in the what? In the spleen. We can also talk about brain injury or what? Stroke. Yes, we can talk about stroke or brain injury. That one would also come in as a complication. In addition to those, we can talk about gallstones formation and also priapism. Yes, those are the complications that this child is likely to develop.